Hi, I'm Dr. Keith McAfee. Welcome to Medicine and Faith, where I give a brief talk about a topic in medicine, relating that at the end to our faith. Today, we're going to talk about asthma. Asthma, for what you and I need to know in terms of treatment, reduce it down to three things. Let's keep it simple. Number one, let's look at the airway. This is an airway. I'm getting basically an airway in the lungs, cutting it, looking at it in cross-section. So here's an open airway, nice and allowing air to move so you can lead the kind of life you want to lead. Here's what happens in asthma. Problem number one, the wall gets thick. Just like when you have a cold or flu or allergies, your nose gets boggy and thickened and you feel like you have narrowed nostrils. The airway gets thick, and of course because the mucosa is on the inside, it swells in, it doesn't expand out, so you get some narrowing of the airway. Problem number two, in the same way that you get allergy and common cold causes mucus production and runny nose, you get mucus production in the lungs. It literally does the same kind of thing. So you get all of this mucus clogging up the airway as well. So now look what you're breathing through, this little narrowed area. Problem number three are the muscles. There are muscles that are wrapped around the airways. Now think of Christmas ribbon, and somebody just got simple Christmas ribbon and started wrapping it around, but they did a very disorganized, chaotic job. These muscles are just wrapped around in chaotic fashion. But in the same way that you can have a leg cramp, a foot cramp, and you get a spasm of that muscle, they tighten. These muscles spasm. This is actually very inflammatory. It's a lot of inflammation in here. It makes these muscles very twitchy, very irritable, and they cramp. Now these foot and leg cramps are quite painful. This is painless, but it cramps nevertheless. And it pinches that airway from the outside. So you get a narrow, pinched airway with its thick wall and its mucus production. And now look what you're breathing through. This little tiny hole here. Now I'm exaggerating to an extent because I want to make a point. But this is not good at all. It's actually quite dangerous. I've had patients die of asthma. They say, I'm fine. No, maybe I'm not fine. And by that point, it can be too late. By the time they get to the emergency room, they're just too far gone and nobody can bring them back, even with the medicines we have nowadays. This is not safe. This is dangerous. Don't play games with asthma. So the question then we have is, how do we reverse this? How do we get from here to here? And the answer is rescue inhalers or nebulizer treatments. Xopenex, albuterol, the Provençals of the world. What they do is they get from disastrous to horrible. This is disastrous. This is horrible. All they do is get you back to here. But they do, and they give you sort of an immediate benefit because you feel better right away because you can breathe better. But you're not getting from horrible to good. And the question is, how do we get from horrible to good? And the answer is, you need things such as corticosteroid inhalers. The puffers we use with Advair, Dulera, Symbicort, Asthmanex, there's a bunch of them. They basically reduce the inflammation, get rid of the mucus. Singulair helps with this. Avoiding antigens, or antigen shots even, where if you have problems with feathers, you don't get a feather pillow. If you have problems with dogs and cats, you try to make sure you have minimal amount of cat and dog hair in the house. They get you from here to here, but it doesn't happen right away. It's a delayed treatment. This, like I said, is fairly quick. This takes time. Let me give you an analogy. I use this a lot of times for my patients. If you have a sinus infection, you have headache, you have fevers, you feel awful, I give you Tylenol, I give you Motrin. You feel better. Your headache gets better, your fevers go away, the malaise lifts, you feel a whole lot better. I haven't fixed a thing. I give you antibiotics, that's going to fix the problem, but not today. Maybe a little tomorrow, the next day. It takes time to get better because it's delayed effect. It's actually fixing the problem, but that takes time. So if I only give you Tylenol and Motrin, I'm giving you a disservice. I need to give you something that's really going to fix the problem. In the same way, these rescue inhalers or nebulizer treatments, they make you feel better right away, but this inflammation will remain, and it'll just, as soon as the medicines wear off, which is a few hours, you'll go right back to here. And you'll just do this vicious cycle constantly with these symptoms because you're not treating the problem. To treat the problem, you do these things and you do them consistently, And you do them almost more by faith because they don't make you feel better right away. But you have to continue them. Let's say you do some, you start to feel better, and you say, oh good, I feel better now, I'm fine. And you stop the medicine, boom, you slip right back into this, depending on how much you're exposed to the things that cause you problems, and here you are in your vicious cycle again. These are things you don't stop. You continue to use them constantly. Now, let me ask you a question. Why, when this is so obviously in our bodies the way we should treat asthma, why do we treat our spiritual lives any different? Why, when we're having constant symptoms of spiritual difficulties, spiritual doldrums, our prayers run dry, our faith feels dull, we have excessive guilt, we're self-condemning all the time, all these symptoms of feeling really spiritually down, why do we just simply try to make ourselves feel better by distracting ourselves or quick fixes? How do we get from here, which is where we oftentimes live our spiritual lives, I don't mean to be negative, but we do that sometimes, to here? And the answer is we do the things that take time, that we do because of a commitment, knowing they're going to fix the problem. We work on our priorities, we work on our habits, we work on our personality traits. Nobody likes to work on their personality traits because we don't like to admit that we have personality problems or flaws in our character. We work on our assumptions on life, such as, oh, I'm strong, I can withstand the storms of life. When in reality, we're very, very weak. In fact, if you think about why we sin, almost always the reasons we sin is not because we're so bad or so evil, it's just because we're so weak. We work on those issues. Now, those issues take time. They're difficult. Frequent prayer. Prayer is the cornerstone. In a sense, it's a good analogy because prayer to our spiritual lives is like breathing to our physical lives. It's the only way we have our faith stay alive. But you need daily prayer. It doesn't have to be long necessarily, but frequency is important. I tell my patients when they're trying to exercise, I would rather have you exercise 5 days a week for a shorter period of time than once or twice a week for a long period of time. Because the habitual, constant physical exercise is much better for you than an occasional burst. In the same way, our prayer lives, frequent, constant prayer, not necessarily long, but daily, is much better for your life than long periods once a week. So, in asthma, in our physical lives, don't just treat symptoms because you're going to live your life here and you're going to be limited the rest of your life in what you can do. You can't do your sports, you can't do your hiking in the mountains because you're living your life here. Treat the underlying cause. Do the long-term, day-to-day constant treatments because they will make you feel better, and also they'll keep you out of danger because this is dangerous. In our spiritual lives, in the same way, if we constantly feel ourselves having these doldrums, these down feelings about either life or ourselves, get to the core of the problem, our relationship with God, our priorities, our character issues that we need to deal with, the things that are hard for us to make ourselves do. But those are the things that bring us to health, holiness, happiness, and get us out of here. This is Dr. Keith McAfee. Many blessings. Thank you very much. I hope you enjoyed this video log, and I hope it's helped you in some very practical ways, medically and spiritually. If so, please feel free to share this video with others you know, friends, family, those you love. And on my website, keithmcafee.com, I have a series of such videos. The list is ever growing on different medical topics. On the website, you'll also find information regarding my book, Breathe, A Physician's Stories and Reflections on Prayer, which is a series of true stories from my medical career and how those stories help enrich and deepen our devotional life on a personal level, not just a theological level. Thank you again for spending time with me, and as always, I wish you many, many blessings.